This is an episode of Unconfined, a podcast of the Johns Hopkins Center for a Livable Future in Baltimore, Maryland. You can find us online at clf.jhsph.edu. Mike Milley is our sound engineer and produced our theme music. Your hosts are me, Tom Philpott, and Christine Grillo. Paulette Wilson is a producer, and Natalie Wood-Wright is the executive producer. The opinions expressed here are not necessarily those of Johns Hopkins University or of the Center for a Livable Future. Welcome, everyone, to this episode of Confined Podcast. We're extremely excited this week to have Debbie Berkowitz on. She is a fellow at the Kalmanovitz Center for Labor and the Working Poor at Georgetown University and has a long and storied career, working for worker justice. Before she got to her current job, she was the Worker Safety and Health Program Director at the National Employment Law Project, and that is where I first virtually met Debbie. I was working at Mother Jones, writing about food politics. It was the very beginning of the pandemic, and I found you to be just an invaluable resource. We talked many times. You explained many very complicated issues to me, and I hope I didn't mess them up too bad in the stuff that I wrote. Just an absolute, just encyclopedia of knowledge on this topic. And she comes by, honestly, before she was at that job, Debbie, you worked for like 6 years for the Obama administration in a couple of different positions in OSHA. And so you really know about what you're talking about. And that's why we're excited to have you on here in this series that we're doing on worker justice in the industrial food system. And I should also note that that Debbie and I are both have chapters in a book that's coming out this fall called it's got the riveting title of Industrial Farm Animal Production, the Environment and Public Health. But it actually is a really, really good book. Lots and lots of great authors. It's a collection of essays. And Debbie wrote a really amazing essay that I've just been reading with James Merchant of University of Iowa on the very topic we're talking about, worker justice and the sort of regulatory gaps that food system workers encounter, especially meat workers. And so, Debbie, I first became aware of your work during the pandemic, and the pandemic was really kind of opened up a view into just exactly what it is that workers encounter in the food system, particularly with meat. And I'm going to just frame our conversation by quoting this report that came out in 2021 by the U.S. House Select Subcommittee on the Coronavirus Crisis. And they looked hard at, sort of OSHA's response to the crisis and how workers fared during it. And they came to some really stark conclusions. And the quote that I wanted to read goes like this: instead of addressing clear indications that workers were contracting the coronavirus at alarming rates due to conditions in meatpacking facilities, meatpacking companies prioritized profits and production over worker safety, continuing to employ practices that led to crowded facilities in which the virus spread easily. And they found in this report that just the 5 biggest meatpacking companies in their plants, and this is by 2021 when this came out, 269 workers had died from the coronavirus in those plants. Just an amazingly large number. Thousands of people got sick. The virus spread to surrounding communities. And we're going to get in this conversation into where was OSHA during this, because this agency is obviously there to come down on employers to protect worker health. But there were clearly problems in this field before the pandemic, and the pandemic sort of exposed them. And I wonder if we could start by by asking you to describe some of the conditions that we know that workers in meatpacking plants encounter. Let's maybe talk about line speeds, how fast the sort of kill line goes in these facilities and how that's changed over time and which federal agencies are supposed to regulate that.
Sure. I'm happy to be here and nice to talk with you, Tom, after all the great reporting you did over the years. I'm really thrilled that you are focusing this podcast on the workers who produce the food we eat, specifically meat and poultry workers, because most people, when they think of concerns they have in the meat and poultry industry, it's regarding animal cruelty or maybe climate change. But this is really an overlooked injustice that I think consumers and the public need to understand. And that is about the safety and health risks facing our meatpacking workers. So this industry is largely made up by design of immigrant workers that the industry recruits because they really want workers who, I call them vulnerable workers, but workers who might be too scared to speak up and too scared to sort of complain because they fear retaliation and possibly don't know their rights. And let me just set it out for your listeners, and that is in meat and poultry plants across the United States, you have thousands of workers a shift working side by side in cold, damp, noisy conditions where they've slaughtered the animals and now they're breaking them down into what you buy in the supermarket. They wield knives and scissors and work in dangerous equipment. They work at breakneck speeds. In the end, they have injury rates for the worst types of injuries that involve lost time that are 3 times higher than the national average for all other industries. They have amputation rates that are between 5 and 14 times higher than all other industries. And in an analysis that I just did of all the reported severe injuries to OSHA since 2015, you find that the biggest meat and poultry companies, Tyson, JBS, Pilgrim's Pride, were among the top 10 reporters of severe injuries, which involve amputations or overnight stay in a hospital. And these rates are really out of proportion with how many workers are in their plants, because take Ford Motor Company, people think auto plants can also be unsafe. But JBS, for example, that has less workers than Ford, has 4 times as many amputations and reports of hospitalization. So this industry was dangerous even before COVID struck. And, I remember I started this work in the early, late 70s, early 80s about advocating for meat and poultry plants, and workers, on safety. And, I remember my boss gave me a copy of The Jungle to read. And if you've read The Jungle by Upton Sinclair, which was at the turn of the last century, the stars of that book are workers who complained about breakneck line speeds and how unsafe everything is. And of course, they also talked about the meat falling on the floor, which led to food safety issues and therefore created some agencies to protect the consumer, but not workers. And breakneck line speeds are still the number one, I would say, hazard in the industry. And it's because they are working incredibly fast, using knives and scissors, making forceful cuts, using awkward postures. And so you end up with, a lot of high injury rates and a very high turnover in this industry. They really go through workers. And
now I feel like there's a regulatory gap between who is supposed to regulate the line speeds. And I feel like, as I understand it, the U.S. Department of Agriculture is charged with regulating line speeds, but they don't do it on the basis explicitly, not on the basis of worker safety. It's based on food safety. It's based on how fast they feel the line speed can go without contaminating the meat with, guts and, microbiota that might be in guts and things like that. And then OSHA regulates worker safety, but they have no control, or they claim to have no control over line speed. And so there's not a whole lot of consideration of workers in coming up with maximum line speeds, right?
So just the way our system of protecting consumers and workers evolved, they're two separate systems. But when it comes to meat packing and poultry, the U.S. Department of Agriculture, which sets the line speeds in meat and poultry plants, which then determines how fast the production lines will go. Their main criteria is about food safety. But the courts have ruled, because they have said that they should also take into consideration worker safety, because one agency cannot issue a rule that's going to conflict with another rule. So if you've got a law that says companies have to protect workers from injuries and death and illnesses and death, you can't have another agency increasing their safety risks because it's better for companies and they make more money. And so under the Obama administration, when I was at OSHA, USDA wanted to increase line speeds in the poultry industry. And at the time, they had a little pilot project going of plants supposedly who were going to increase their line speeds to see what the net effect would be on food safety. But almost none of them did, because they couldn't keep workers at those speeds. It's, breakneck. It's really tough work. Poultry plants, most of the plants that we were in at OSHA had 100% turnover. So they couldn't even keep workers, let alone speed up the line. And in addition, the National Institute for Occupational Safety and Health went into 2 poultry plants, and at existing line speeds, they found that 30 to 40% of workers on the line who were, with their knives and their scissors, cutting up the chicken, had carpal tunnel syndrome, which is a musculoskeletal disorder that is caused and very prevalent in meat and poultry plants, that is caused by highly repetitive and the forceful work, and how fast it goes. And so the United States Department of Agriculture under Vilsack said, well, we're not going to increase line speeds in the industry. Then you fast forward to the Trump administration, who really doesn't care about workers. Despite all the evidence that increasing line speeds in the pork industry would lead to more injuries, they ignored it. And the courts ruled that what they did was illegal, that they have to take into account worker safety. And so therefore, under the Biden administration now, and I have to give USDA and Tom Vilsack a lot of credit here, they are really trying to look at what's happening in the industry in terms of worker safety, and so that they can sort of figure out what they should do, as opposed to just listening to industry that says money, money, money. That these are Tyson, JBS, Pilgrim's Pride. They're like 5 companies that control this whole industry. They're billion-dollar companies, but they really just want to eke out as much profit as they can at the top for themselves and not for the workers. So OSHA has cited meatpacking plants and did a lot in the late 80s and early 90s, with Clinton and George Bush, cited meat and poultry plants for causing carpal tunnel tendonitis and other musculoskeletal disorders, because not only was it how fast their lines were working, but the kinds of forceful, repetitive stresses that were put on the hand and your wrist and the back and the shoulder in the nature of the work. People aren't just waving hello repetitively or looking at something. They're slicing meat. They're bending and twisting. And I remember in the early 80s, that's when I first got my first call from a local union that said that workers in Virginia in a poultry plant had carpal tunnel syndrome. And I actually had never heard of it. But so I went down to visit, and all these women were working on the production lines, deboning and eviscerating. And they had this illness where they couldn't go back to work. And so the National Institute for Safety and Health, and this was under the Reagan administration, came in and hired experts from the University of Michigan, Tom Armstrong, to come in and look at what was happening. And they said, if you look at the stress and the repetition of these jobs, that it's going to cause these injuries. And that one of the ways to decrease it is you can reduce the repetition, and you can, by adding more workers to the line, so workers work a little bit less, but also change the knives that they were using, put a better grip in, bend the handle bend the blade as opposed to a straight blade, because then workers could keep their wrists straight. And the industry just ignored that suggestion. And, there's clearly feasible ways to bring down the high rates in these plants. After the Clinton and first George Bush administration cited so many companies that don't exist now, that were gobbled up by Tyson and JBS, but IBP and Montfort and Armitage Effort and Goldkist. These companies tried to correct the hazard. But then under the George Bush administration, OSHA had tried to write an ergonomic standard. Ergonomic is doing exactly what I said, is creating jobs that are highly repetitive, that don't cause injuries by, either reducing the speed or reducing the force in terms of keeping your wrist straight. It's like, when you bend, you're not supposed to pick up from the floor or reach overhead. That's ergonomics, keeping the body in the position, in neutral position, so you don't get hurt. That was overturned by Congress when George Bush became president. And what they also did, which was really bad, is they took off that every company in a dangerous industry, has to keep records of serious injuries and illnesses that require medical treatment. And on these forms that OSHA creates, they took off any reference to carpal tunnel syndrome or repetitive trauma disorder and tendinitis. So I think the message to the industry, and meat and poultry industry, is you don't have to record these, and probably don't have to pay attention to them anymore.
One of the things that I think is just mind-blowing, and I dug into it when I was writing about this a couple of years ago, I think, and you pointed me to this research. The studies that you mentioned, where they go into two plants at existing line speeds, not the sped up lines, and they find 30 to 40% of the people, these are just random, normal plants, have carpal tunnel or other repetitive stress injuries. That is absolutely mind-blowing that that situation prevails when we have this OSHA law, where we have this agency that is charged with protecting worker safety, and it's just being sacrificed as a matter of course. And, like you said, some of the measures that could improve it would cost the companies money, but they're extremely profitable. But, hiring more workers so everyone has a bit of a lighter load, coming up with modified, specially designed knives and things like that. I just wonder if you could talk about, so since that ergonomic standard, so they developed it, it comes out in, I think, 2001, right? Just after George Bush takes power. Congress goes to this kind of obscure law where you can rescind the previous administration's rules within a certain number of months. They use that to rescind the rules. Can you talk a little bit about what did OSHA just sort of walk away from it, or how are they dealing with carpal tunnel nowadays? And I got to say, I've talked to a bunch of meatpacking workers, poultry workers specifically in my reporting, and everyone you talk to has complains of just body aches and, if not, diagnosable carpal tunnel. It's as a matter of course, this is what happens when you work in this industry.
Right. In addition to very high numbers of amputations and cuts, they do have these musculoskeletal disorders, which can prevent them from working, not only at this job, but at any job that involves any kind of hand, wrist or shoulder, or even lifting. So the history here is that the OSHA law was created in 1970. In 1971, OSHA started, but it's a really weak law. It was a compromise. It was, Nixon signed the law, and it's not the strongest. Right after that came a lot of environmental laws that are much stronger. And so, OSHA, in order to write specific standards that employers have to meet, had a much higher burden than other agencies did when it came to protecting workers versus protecting the public. And OSHA was never funded the way it was supposed to be, so that, now it would take OSHA 160 years to get into every workplace once under its jurisdiction. It's sort of a political football. Under Republican administrations, OSHA issues no regulations, no new regulations, and the budget's cut. And so under Obama, we had 1,000 inspectors at one point, but once the Republicans took over Congress, OSHA only had 800. And under the Trump administration, the number of OSHA inspectors fell to the lowest in the history of the agency. And so, yeah. And so now it's coming back up again a little bit, but of course you've got Congress now refusing, the Republicans are just blocking any kind of budget. So I'm not sure what's going to happen. And in the end, it's really bad for working people. It's bad for American workers because, when companies know that possibly OSHA is out there, even though the odds of them getting inspected are so low, a lot of them will comply with the law. But so I think what happened is OSHA did try under the Clinton administration to pass a rule that if workers were getting carpal tunnel or tendonitis in your workplace, you had to figure out what was causing it and then try to reduce it. That's really what it was about. It was very simple. But a law had been passed before that called the Congressional Review Act. That's getting really into the weeds for your listeners, and it had never been used before. But the George Bush administration used it, and the regulation came out in November, right before Bush took office. Came out in 2000 and 2001. Bush took office, and Congress immediately overturned it and just threw it out. And so there goes 10 years of OSHA's work on these protections. And then truthfully, under the Bush administration, they just ignored ergonomic hazards. They ignored carpal tunnel and tendonitis. They really did very little enforcement, very different than the past 12 years. And you really saw a slide in worker safety in the industry. Plus, the industry during that time became mostly immigrant workers. The majority of workers are immigrant workers in this industry now who are very scared to speak up. You saw a lot of drives in the poultry industry here in my backyard in Harrisonburg, Virginia. The companies got emboldened and they, defeated the union in a lot of the plants. And so workers were really on their own and they were very, scared to speak up. And so, even though NIOSH found during Obama administration that 30 to 40% of workers in these poultry plants had carpal tunnel syndrome, they gave them medical exams. Two things I want to know. One is when NIOSH came back in, like 6 months and 9 months later, to sort of do some more work, a lot of those workers were already gone. Because once you're hurt, you can't keep up. And then the company just says, you can't keep up, you got to go. And the other thing was when you looked at the company's logs of injuries and illnesses, they had very few cases, like maybe 1 or 2 or 3. And that's because, and I wrote a paper about this in the American Medical Association's Journal of Ethics, that companies, meat and poultry companies, many of them have turned their first aid stations where you go when you're hurt and say you need to see a doctor. They prevent workers from going to the doctor. They won't send a worker to the doctor because once they send a worker to the doctor, they have to record it on their official injury and illness records. And they want to say to the public, we have no injuries and illnesses. We are safe. And so workers aren't sent to a doctor and they're constantly sent back to the line. They get worse. So they quit and they go to the doctor on their own and the company doesn't have to record it. So though 30% or 40% of workers, these are hundreds of workers in these plants, had carpal tunnel syndrome. One plant only had 3 cases on their official logs because only those 3 got to see a doctor. So, the industry's been very good at hiding these injuries and saying, oh no, we're actually much safer than we are.
And if you go to the National Chicken Council website, you'll see they have a part of their website that says, worker safety. And you'll see this, downward sloping chart of, worker injuries, and it looks great. But as you're saying, they're just, able not to report these, just stunning levels of injury.
Right. The industry hasn't really changed since I began in the 70s and 80s, where you had 25, 35, 40% of workers on the logs. And all of a sudden, during the George Bush administration, rates went down to 11%, 9%, 2%, because even the USDA and 3 other government agencies, including OSHA and NIOSH and the Government Accountability Office, have all said that these numbers are not accurate. These are self-reported by the industry, and they know it is underreported. And in fact, USDA said this in their rulemaking when they said poultry plants can't increase their line speed is because you can't depend on the injury records that are self-reported by the companies. I mean, it's really, it's a false narrative, and it's really something consumers have to think about, when they buy their meat and poultry, is what's happening behind, the packaging here to the workers that produce this.
Yeah, whose body is being sacrificed for this cheap chicken? One thing that doesn't get, I don't think, nearly enough attention, that when you talk to poultry workers, you hear about it, are the incredibly strong smells from these sort of caustic chemicals that the industry uses. And I think it's really kind of part of the line speed problem and part of this consumer safety being put ahead of worker safety. And so if you're going to have a line speed going that fast, you've just got to sterilize everything, including the chicken itself. They will plunge chicken into baths of really strong chemicals. And it just creates these odors that cause all kinds of respiratory issues. And I wonder if you could talk a little bit about that.
Yeah, especially in the poultry industry, where the industry lobbied very hard. And now because of that, there are less USDA food safety inspectors in the plant. They really don't have to do any testing. And because we know that there are these pathogens on the chicken, in order to protect consumers, the industry sprays constantly and dips the chicken in vats of one of the chemicals is called peracetic acid, which is sort of an antimicrobial, which is, good for consumers because it'll kill the pathogens. But workers are completely exposed to it. It is one of these chemicals that'll irritate the eyes and skin. It causes severe rashes and burns, and also affects the lungs. And it's really one of the things that workers complain about a lot. And, these systems can be enclosed. There are a lot of ways to reduce worker exposure if you're going to have to dip the chicken repeatedly in a chemical bath before you send it to consumers. The good news for consumers is that these chemicals dissipate, so it's not in the product when you buy it. The bad news for workers is it's being sprayed on them. They're working right next to open vats where the chicken product is sent through. And most of them have never even been trained on what this chemical is, and they really don't know. And I just, once again, it's a hazard that workers face. And I just want to also say that in the past 6 months, I have talked to poultry workers in Mississippi. I've talked to their representatives and representatives of meatpacking workers in some Western states. And one of the things that I remember during the 90s was a big issue in meat and poultry plants was that workers didn't have time to go to the bathroom, so they wore diapers. or they went on themselves. And this is a real issue for worker health, urinary tract infections, but also consumers. Like, hello, this is a bad thing if workers are soiling themselves producing, food. But it's because the industry didn't have replacement workers when they needed to go to the bathroom if they were on the line. And workers get very short breaks. And there's 1,000 workers going to the bathroom all at once. And they have to take all their protective equipment off. They all wear metal mesh gloves. They wear hair nets. A lot of them wear metal mesh aprons. They wear rubber gloves. That all has to come off. They have to sort of sanitize their feet, walk out to the break room, eat, and somehow get to the bathroom and come back. Most of them never get there. And just recently, as I mentioned, in Mississippi and some of the Western states, I've heard that this is a huge issue. Workers are wearing diapers or workers are soiling themselves. That, the speed up of production and not having workers to take the place on the line when somebody has to go. This rarely occurs in other industries, industry-wide like it does here.
And I remember maybe five or so years ago, I think it was Oxfam came out with a report about this very thing. And there were a bunch of articles about it. I think I wrote an article about it for Mother Jones, and yet it is still happening. And I also remember when Amazon delivery workers were put in a similar situation that made huge headlines. I mean, this is something the public finds appalling. It's human, in addition to all the health issues and possible consumer issues. It's a question of human dignity to be able to use the bathroom when you need to. And it's just stunning that in 2024, this group of workers that doesn't always have that right.
Yeah, it is completely stunning. And, one of the things about Amazon workers, and you got to give them a lot of credit because they work in very harsh conditions, is they'll speak up and they'll speak out. They know their rights, but poultry and meatpacking workers are too scared to speak up. Literally, during COVID, when 1,000 workers in a plant, were getting COVID and people were dying, I couldn't get one worker to use their name to speak out with a reporter until somebody died, because they were scared the company would retaliate against them. And also because under the Trump administration, they did raids on meat and poultry plants. They did immigration raids and got rid of all these workers. The company didn't pay any price for hiring them. And I think actually recruiting them, they know who's getting in their plants. And so, I think, absent immigration reform, so these people would know that they have rights and can exercise them. It just enables this industry to, hire and recruit and bring all these, vulnerable workers into their plants and then deny them sort of basic rights here.
Yeah, it's crazy. Okay, so basically this whole conversation until this point has been about the way things were before the pandemic, and in many cases still are. In most cases, basically everything we've talked about is still happening. But then there was the pandemic. It happened. It was absolutely gruesome. I talked to workers in the middle of it, and it was just. I shudder thinking about the trauma that people went through, seeing coworkers die, living in fear of bringing the disease home to their families. There being, huge gaps in healthcare in these regions, and where a lot of the plants are. I wonder if you could talk a little bit about, because, you were right in the middle of, sort of bird dogging the issue, talking to workers yourself, keeping up with it. You obviously know very well of, what OSHA can and cannot do. What are some of the things that OSHA could have done to make this less horrific for the workers during this period?
So, as we explain in this chapter of the book that I wrote that'll be coming out soon, from the beginning of the pandemic, even before a lot of people realized this in early March of 2020. COVID-19, then it was called, infections and death. It just tore through meat and poultry plants, and all over the country. Some plants witnessed alarming rates of infection between 20 and 50% of plant workers. And the studies found that of this, in the surrounding communities, that not only were meatpacking plant workers affected, but then it spread into the surrounding communities, causing hundreds of thousands of additional infections and so many more deaths than would have been if the industry had decided to protect workers and control the spread. And instead, right at the beginning of the pandemic, the industry just kept right on going. Workers were working shoulder to shoulder, crowded in break rooms, crowded in lunch rooms. That when workers were sick, they had to keep on the line. They weren't allowed to leave. That when workers showed symptoms, they weren't asked to quarantine. And in fact, in one meatpacking plant in Iowa, because the company said, just keep on going. Let's not, implement measures to mitigate the spread of COVID. The supervisors started betting on how many of the plant people would get sick. And so, what people need to understand is there's some laws in the country that are weak. And so, as I said before, OSHA is sort of a political football. So the Trump administration just really decided not to enforce the OSHA law. They decided, even though workers filed complaints with the agency, which is how OSHA gets into plants, is workers file complaints about serious hazards, or somebody dies and OSHA can get in. But that's really the way OSHA gets into facilities like meat and poultry plants. OSHA just ignored the complaints and did not do inspections. They would send letters to the company saying, we hear you may have a COVID outbreak. The industry would write back. The company would write back, we're doing everything we can. The OSHA would say, okay, thank you. And meanwhile, thousands and thousands and thousands and thousands, tens of thousands, hundreds of thousands of workers were getting sick. So, it just was, the Trump administration just decided not to enforce the law. They didn't give OSHA inspectors the kind of mass they would need to do inspections when it came to meat and poultry plants. And so workers were just on their own. And, workers don't have the right to sue an employer in this country if they're exposed to unsafe conditions. So without OSHA out there listening to them, and when OSHA failed to inspect when they got initial complaints, a lot of these plants suffered huge outbreaks. So it all, the rates could have been a lot less during the first 2 years of the Trump administration in this country if, OSHA had been allowed to go into those plants that were hotspots and require basic protections. Workers that are sick have to stay home. Workers that have been exposed, they have to be monitored for signs and symptoms, giving masks. And when they're soaked with blood, replace those masks, separate workers farther apart so they're not working right next to each other, breathing on their workers, in terms of break rooms, put them outside under big tents. There are a lot of measures that these companies could have afforded to do, and did not do them.
And a lot of them, would have probably meant slowing down production. And I think we could have had a conversation in the country about, we want to keep our meat supply coming. And one thing that always bears saying is that the companies had reserves of meat frozen in a lot of cases, and they claimed there's going to be a huge shortage, but they could have made up for a lot of the shortage with by releasing some of the frozen meat into the market. But
right, I think I want to weigh in here, because the industry, what they did is they terrorized everybody by saying, there'll be meat shortages. But in the end, they had to close a lot of plants because they couldn't find workers. Everybody was sick. But the other thing is, some of these plants, like that plant in Iowa I talked about, where so many workers got sick that actually the local hospital went on national TV to say, plead with the industry to do something, all that pork went to China. So it's not that it's this whole thing about meat shortages was a ruse, and the industry, just they'll use any excuse. The Biden administration went after the meat industry after COVID to say, you are artificially raising prices for no reason. And remember, just a couple of companies control most of the industry. So they really can raise prices. I think that, had they slowed the line, had they protected workers, we wouldn't have had, the problems we did and the spread we did.
Yeah. We probably would have had less supply disruptions by slowing production and protecting workers than we did when an entire plant had to be shut down because essentially everyone was sick, which happened a few times. And
the other thing is that the other thing that industry did, I just want to know in this, and I don't know any other industry that did this, was when local health departments wanted to shut down a plant because so many workers were sick and it was spreading into the community. And because of that, members of the community were getting sick and dying. The industry went to the Trump administration, right to the White House, right to and to the Trump USDA and said, please intervene and don't let them shut us down. And that's what happened. And I've never heard of that before. So
I believe Trump invoked the Defense Production Act, which is a presidential power that he could have used to, generate more masks, or there were shortages of protective gear at the time. And he didn't do that, but he used it to give the meat industry the power to keep going in case.
He tried to do that. He said he did it. He did a big press conference, but the lawyers all came out right away and said, the Defense Production Act does not give any meatpacking plant the authority to keep running if a local health department wants to shut them down. So once again, Trump made worker safety a political football instead of misrepresented what was what the real law was, and workers get intimidated. They got scared. It was a nightmare what happened to meat and poultry workers. And, you have to, every time you go to the supermarket now and you buy chicken or meat, you've got to say a prayer for them and thank them for what they did and what they sacrificed.
Yeah. And so beyond prayers, let's look to the future. In your chapter with Jim Merchant, there's a section at the end with some things that OSHA and policymakers in general could do. I wonder if you could talk through a few of those, some of the more important ones, and also talk a little bit about what kind of political buttons have to be pushed to make it happen. Obviously, we've been, these issues have been with us for a long time. We've just talked about how they've been going on since the 70s and 80s, and progress keeps getting blocked. But I think the pandemic did raise awareness. There has been some movement in Congress, at least among some members, floating bills that could address some of this. So I wonder if you could talk about some of the reforms that we need and how we could get there.
Sure. Though I'm not optimistic like you are, because I do know that the meat and poultry industry are incredibly powerful. And especially in a lot of states, they sort of run the state. And and they don't really want worker safety to be a priority here. But, you've got Senator Booker writing this wonderful bill to protect meat and poultry workers. And one of the things it does is says that OSHA, you have to write a specific standard for the meat and poultry industry. OSHA has a lot of very general standards, like when a machine needs to be guarded, or when how to protect workers against using equipment when they clean equipment. And, workers, just a 16-year-old just got killed in Marjack in Mississippi and first of all, you're not allowed, this company illegally, and they've been caught hiring children. You have to be 18 to work in a meat and poultry plant because it's so dangerous. But besides that, a 16-year-old was killed because he was sucked into a very dangerous piece of machine in a chicken plant because the company failed to protect, put in policies to protect this worker. But what Senator Booker's bill would do, and also the Government Accountability Office just came out with a report on this, that there should be a specific standard just for meat and poultry that covers the dangers to machines and groups all the standards that are applicable, but also writes new ones to control the high rates of musculoskeletal disorders, requiring companies that when they have, these disorders, that they have to, investigate ways to reduce and implement mitigating measures. They have to have first aid stations. There are I just talking to a local union president who told me that I think there are 15 languages spoken in her plant, that the first aid stations have to be able to have translation services for all the workers, that they have to provide medical care and referrals to doctors on time so that, workers, the Government Accountability Office found that workers with broken bones, carpal tunnel, and other severe injuries were never sent to a doctor. And so they got worse. And so, these have to be addressed in specific standards. I think, really, because the industry is not going to implement all these practices and procedures on their own. I think at one point in the 90s, when the industry thought there may be a standard on ergonomics, they did start implementing a lot of these safe processes, and then it all ended.
Right. And we could totally have a plentiful meat supply and not sacrifice workers. Maybe not quite as cheap as it is, but we could have a plentiful meat supply and not impose all of these unbearable hardships on the workers that produce it. It would just reduce profits a little bit. That they would still be profitable companies.
That's true.
So, I know Booker's bill is not going anywhere in the current Congress. Do you see this bill having traction in the future? Do you see any change, like more members getting interested in it? Have you seen a trend like that?
Well, I think one thing that COVID did, in terms of awareness, is the public as well as congressional representatives became aware of how limited worker safety rights were in this country. You slip on your neighbor's slippery steps and you get to sue your neighbor. A worker slips, the company, didn't take ice away from their slips, and a worker, maybe if they're lucky, will get workers' comp for their medical bill, but they can't sue the company. They may file a complaint. OSHA may not come in because they doesn't have the resources to cite the company for not providing, floors that were clean and dry. And so I think that is looking, has different, senators, some different states. I know Minnesota, for example, is really looking at trying to increase oversight of the meatpacking industry and the poultry industry in that state because of the high rates of injury. And of course, in that state, the state found children working in meatpacking plants. So, I think some states are moving forward, and maybe there'll be things federally. But at the same time, you have, like right now in Indiana, you have like Republicans putting in bills to allow children to work in meat and poultry plants, because, you've got, which I'm hoping will be overturned today in a hearing, but, you've got, still sort of the forces of, it's okay for industry to exploit workers. And really, I just hope more unions that get stronger and more powerful in this industry and speak up, because it's really the unionized workplaces where it'll make a difference. But the industry has been, by hiring a lot of workers, a lot of them don't speak English, they don't know unions. It's been very hard for the unions to sort of keep up.
And also, the poultry industry really explodes, like starting in the 50s and 60s and 70s, and as it's getting bigger and bigger, it's moving to the South in the right to work states. So you set up shop in Arkansas, you set up shop places like Mississippi, in these places where it's really hard to unionize. So you have really low union rates in poultry compared to meatpacking, which tends to be in the Midwest, not 100%. One thing that we should talk about before we let you go is, you just mentioned it, this really stunning trend in the past year of reports of the industry hiring minors. There's an excellent New York Times reporter whose name I'm forgetting has been
Hannah Dreyer.
Yeah, who's been putting out just blockbuster reports. How and why is that happening? And also just comment. You mentioned Indiana, but the governor of Arkansas,
Iowa,
Ms. Huckabee Sanders, Iowa, Ken Reynolds are pushing similar bills to allow minors to sort of, instead of changing the problem, just make it legal is the strategy. And so we don't want to leave our listeners on a false positive note. Let's talk about this appalling trend and where you see it going.
Yeah, it is totally terrifying. I've been doing this work since 1978, 1979, a worker safety advocate for food workers, for meat and poultry and other workers. I was the safety and health director at the AFL-CIO and the United Food and Commercial Workers Union, then in the Obama administration, and then at a nonprofit, and now at Georgetown. And it never, ever would have even, I would think about the child labor laws would try to be weakened or repealed. These are laws that have been in place really since the 1940s. Frances Perkins, the Secretary of Labor, the Fair Labor Standards Act. And these child labor laws are updated with data on worker safety. And when I was in the Obama administration at the very beginning, the next update was implemented based on data and science done under the Bush administration. So it was bipartisan. And they agreed that there are 17 occupations in this country which are too dangerous for anybody under 18 to work. Some of them you can be in a apprentice or student learner program with that meets federal standards. You can work in. And what they did in Iowa is they said, no, any kid can work in these dangerous industries, and they don't have to be in an approved apprentice or student learner program. You could just invent those programs. Indiana had just proposed it a couple of days ago, the same thing, and said that if a worker gets injured, a young worker who is 16 and 17 in these dangerous jobs, or 14 and 15, that they don't even get covered by workers' comp, that they just have to, eat the cost of their own injury. So I heard this morning that is now being repealed. But instead, what you've got is another move to allow young kids to work till 11 o'clock at night, as opposed to 9 p.m., to work 6 hours a day after school, as opposed to just 4 hours. So there's a real push and this is coming from a foundation run by this company called the U-Line in Wisconsin, a big paper company. They fund this foundation. I believe there is a move to try to get states to pass these draconian rollbacks in child labor, which, mind you, are illegal. So you have to follow the federal law. A state cannot just weaken a federal law. But because there's almost no enforcement federally, employers are like, what the hell? We'll do this, because the thought, or the odds of an inspector from the federal government knocking on my door is so low. But I believe what they're trying to do is set up so that they can go to Congress and say, you have to repeal child labor laws. And that would be such a huge step back for this country. Kids 14, 15, 16, 17 can work in so many jobs, so many hours. I worked in a supermarket. I worked, in an ice cream store when I was in high school, all legal. And, I think this is just something that people really need to watch. And of course, the meatpacking industry is caught hiring underage workers in the most dangerous jobs, cleaning the equipment at night. When they hire subcontractors to bring in workers, wink, wink, who may or may not be underage. This way the company can say, oh, I didn't know. But the companies know who's in their plants. They take pictures of everybody in the plants. And more than that, they have their supervisors there at night during the cleaning process. So why have kids working in the most dangerous jobs? Because they don't want to pay enough to get adult workers. And this is cheaper. And kids stay up all night and then go to school. There are kids that the Department of Labor found who were 13 in these meatpacking plants, big meatpacking plants, billion-dollar companies. So we really, as consumers, need to make our position know that this is unacceptable.
Any listeners who haven't read this stuff, Google Hannah Dreier, New York Times, and I'll put some notes in the accompanying blog post that have that in there. But it is just, as someone who's been on this beat for a long time, I read these stories, and I didn't know I could be shocked anymore covering the industry during COVID, and to have this coming out post-COVID with this, upsurge in child labor is just incredible. Well, Debbie, thank you so much for coming on. Thank you so much for your time. As always, I leave our conversation smarter than I went into it. You're just an incredible source on this, and I'm really glad to get your voice out to our listeners.
Thank you for having me.
This is an episode of Unconfined, a podcast of the Johns Hopkins Center for a Livable Future in Baltimore, Maryland. You can find us online at clf.jhsph.edu.